Everybody hi. Bronchitis is a clinical diagnosis characterized by cough with or without sputum lasting days to weeks or months to years in the absence of radiographic evidence of pneumonia. Other symptoms may include wheezing, chest tightness, and fatigue. Acute bronchitis lasts less than 3 weeks, subacute bronchitis lasts 3–8 weeks, and chronic bronchitis defines as a cough with sputum for at least 3 months per year for 2 consecutive years, most often related to smoking or chronic lung disease. While the underlying pathology involves inflammation of the bronchi, the diagnosis itself is based on clinical presentation and exclusion of pneumonia. Causes. Most cases are viral. Bacterial bronchitis is much less common. Environmental exposures like smoke, dust, chemical irritators, polluted air can also trigger or worsen bronchitis. Treatments. Antibiotics not routinely recommended, only if bacterial infection is suspected. Oral steroids not useful in typical cases. Inhaled corticosteroids or long-acting beta agonists reserved for patients with asthma or COPD. Supportive care, hydration, rest, humidified air, and over-the-counter symptoms relief. Mucolytic agents are used when the sputum is thick and difficult to clear. They reduce mucus viscosity, making expectoration easier. Examples of mucolytic agents: N-acetylcysteine, oral or inhaled; ambroxol improves mucus transport; bromhexine, oral mucolytics; and guaifenesin, common OTC expectorant. How to use them? Orally or inhaled, always with good hydration with enhanced effect. Typically used short-term during the symptomatic phase. In children or patients with chronic lung disease should be prescribed with medical guidance. Prevention focuses on reducing risk factors and supporting overall lung health, avoiding smoking, minimize exposure to irritants, practice good hand hygiene, get recommended vaccination, especially against influenza and COVID-19. Pneumococcal vaccine may be considered in at-risk patients. Use protective mask. Maintain strong general health with adequate sleep, balanced nutrition, and regular physical activity to support immune function. Treat underlying chronic diseases like asthma, COPD to reduce the risk of recurrent bronchitis. Thanks for likes and sharing.